I'm Kevin Briggs with Simarn Solutions, and thank you for joining us. Today I have Karma Wilson. She's the head of informatics and quality here at Southeast Colorado Hospital District. Southeast Colorado Hospital District is a rural community health center, critical access hospital in Springfield, Colorado. And we're going to talk a little bit about today about the special needs of rural and community or critical access hospitals, the special challenges that they have being rural and remote, and also what the experiences have been like as they've gone through quite a lot of work doing a conversion from one medical record and billing system to another. Karma, thank you for joining me.
Thank you. Thank you for inviting me.
My pleasure. My pleasure. So, how long have you worked? How long have you been a part of this team here?
I joined in 1998 in January.
Goodness, that's a lot of time. Did you grow up in the area? Is Springfield home for you?
No, I'm originally from Wyoming, so no.
Gotcha. Is your husband originally from this area?
Yes, born and bred.
That seems to be a common theme. Either this is home or the spouse, this is home, and it's a beautiful town. The people here are just wonderful.
Thank you.
A real sense of community. In fact, it's been fun, frankly, to walk up and down the halls and watch how you take care of folks. So,
thank you. I appreciate that.
So, tell me about the implementation to the new medical record system and kind of what that was like, and then what happened when we were able to get involved with putting Tasha on site.
So we were going through a lot of changes. We had lost a CEO, we lost a physician or a provider, and then we were finishing up some major construction during the summer, and had an interim CEO come in, and he ended up letting a lot of people retired because they didn't want to move to the new computer, or there was just a lot of changes happening with positions and jobs. And so when we went live with Cerner, there was so much already in turmoil.
Yeah.
Go live. And we were fortunate enough to have a lot of new implementation people. So there was a lot, and they also seemed to be going through a lot of changes at the same time. Yeah. So we were getting new different people building parts, and then they would either quit or go on to a different position, and then you'd have someone new come in and start to build. So it didn't get quite the attention we would have hoped if the new EHR would have gotten. So we ended up not being able to get bills out. We weren't getting medications charges to drop appropriately. There was just a lot of problems, and being new to the system, none of us really knew how it worked. We did the training they had suggested online, but it didn't go in enough depth to absolutely train us to do the job. One of the biggest problems and hurdles is the system is very much for a hospital a little bit bigger or a lot bigger than ours.
Yeah.
And they have a lot of silos. So you do this piece, that's all you do, that's all you see. This person does this piece, that's all they do, that's all they see. And when you're small, and any rural hospital will tell you, when you're small, you may have one person doing, we have the case manager who works part of the surgery team, who's works the floor, who also does the coding. So it's not a silo type position when you're in a small hospital.
Yeah, you all have to wear a lot of different hats, and if it needs to be done, you need to go and do it.
Right. And you have to be able to switch positions quickly and effectively and actually understand how each position works.
Yeah, and how they relate to each other as well.
Mm-hmm.
So then about 60 days ago, I think that's kind of where we picked up the story from Simarn Solutions standpoint. It sounded like you really needed some help, some at the elbow support, somebody who knew the Cerner system and could could basically dive in with both feet and both hands and start helping. And we put Tasha on site with you guys. What was that like as you started?
It was a real positive because a lot of our workflows wasn't working.
Yeah.
One of the providers was really struggling to get her work in at the clinic, at the hospital. Turns out that part of her profile was missing.
Yeah.
So she wasn't getting the things that she needed to do her job effectively and quickly. And that caused more problems. So she didn't know she was missing anything. The other providers were like, well, this is what I do. And she's looking and she's not figuring out what they're doing that she can't do, because we don't know what we're missing until somebody comes in and says, wait a minute, you should have something.
And she wouldn't be able to bill then, would she?
No, it held up a lot of billing. So that definitely will affect and has affected the bottom line.
Now, as I understand it, she's since been fixed.
Yeah, that was a real challenge, but that did finally get addressed. So because a lot of people are thinking, you just didn't do your learning journey. They're not actually getting on and looking and saying, well, you're missing that. Why don't you have that? And I'm like, good question. I would really like to have that item.
Yeah. So I know that Tasha maintains a tracking sheet, and it seems like there's 250 challenges or issues on the tracking sheet, and 150 of them are resolved. And for every 2 that get resolved, there's one more that comes up.
That's right. Because the more we work through it, the more we find we either don't have it, or the permissions weren't given, or the person that had the ownership is no longer here. So there's just a lot of, real time problems.
Now, she's done a lot of implementation work at other hospitals and facilities. Has her perspective in workflows and best practices at other facilities been helpful?
I believe they have. It definitely has helped the physicians over at the clinic.
Yeah.
It's helped the nurses. There's things that we didn't realize, we quite didn't understand how the workflow should have been.
Yeah.
And there's things that we weren't aware, like each module is separate and unique to itself. So while you're thinking it should flow through the systems smoothly, it may not.
Yeah. I know it's a big part of her goal as well, to not only be at the elbow support, but also to make sure that your teams are as self-sufficient as possible.
Right. So that going forward, new people coming on will be trained all the way through. I mean, we are still going to be working on long-term issues even after Tasha leaves us.
Yeah.
But they're going the right way.
But at least your foundations will be a little bit firmer.
Oh, they're a lot firmer. Definitely a lot firmer than they were.
Well, that's definitely good to hear. If I can shift gears for just a second. For folks who have not experienced rural medicine or critical access hospitals, can you kind of give a description of what it's like to be in this kind of environment and what some of the special needs and challenges are?
Well, part of the being in a very rural hospital is you lack the ability to pull people into work because you're rural and there's not like that convenient college that's down the street.
Yeah, you're 3 hours from the nearest airport.
Right. A lot of people don't want to move to the rural areas. Not a lot of activity, not a lot of things going on.
Yeah.
The other thing is, when we have emergency, it's everybody on hands. I mean, you have farming accidents, semi accidents. We have all the big things that happen in any big city, but we have to figure out how to transport and do it effectively and send the medical information completely up to the next facility.
Yeah.
And nowadays, without a really effective EHR and actually able to capture that information, it doesn't happen.
That's challenging.
Yeah. Right now we have, I believe, 15 nurses some have, one has their master's, and we have several that have their BSNs, and a few with their RNs. And that manages the surgery, the hospital, the inpatient side, outpatient, emergency room, does the quality, does the infection control, so when you start thinking about, you have 15 people pulling this off in a hospital, and then you got certain staff dedicated to the clinic, but they don't do just clinic. They do the case management, they do the injections, they do the, there's more to it than it looks, with very limited staff happening.
The vogue in business is to cross-train your people. If you don't cross-train, nothing gets done.
That's exactly right. And it's basically, you get to be a jack of a lot of different trades, so that you sometimes were never taught in school. It's just the way a small hospital runs.
And it's been a fascinating exercise. I did get to see a small emergency a few weeks ago, and it seemed like everybody dropped what they were doing and picked up the rope and started pulling.
That's right, because there's no other way to do it.
Yeah. Well, Karma, I really appreciate you spending some time talking with me about this. It's been a wonderful experience for me to spend time with you and the rest of the staff and see how things operate here. And I'm just so thrilled to death that we can help out.
I appreciate you. You guys have no idea how much you've helped. And it'll really make a big impact on our community as we go forward.
Oh, that's good to know. Thank you so much.
Thank you.
Bye-bye.
Bye.